Well, here we are with Dr. Josefina's Way, and my special guest is Dr. Pierone, who specializes in facial fillers. Darling, thank you for coming.
Thanks to be.
Of me here in your office. I'm so excited with you because you've been really focusing lately in fillers, facial rejuvenation. And please tell my viewers, how do you got into this? Because you are a regular doctor. And you were doing...
Yeah, I actually got into doing facial fillers through my work with HIV. I'm an infectious disease doctor, and some of the medications that we treat patients with would produce facial loss. So I was treating HIV patients with Sculptra Radius.
Facial loss meaning what?
Well, the medications, they would lose the fat in their midface, and even though they were getting better, they were responding to the medication. They looked very thin, they looked ill, and so it was almost like a mark. Okay, this person has HIV, look at their face, they have a characteristic look.
Okay, was it easier for you to make that transition from treating this kind of HIV and going into facial fillers? Was it easy for you?
Well, I never really considered it. You know, I was just treating my own patients for a few years, but then I started getting requests from family and friends. You know, hey, Joe looks good. Can you help me look better? And so that's when I first thought about doing it.
Oh, wonderful. Go ahead.
Well, it was, I had a little bit of an identity crisis because I was like, well, gee, I'm used to taking care of sick people, treating serious disease, and now I'm just going to be treating wrinkles. So I had a little bit of an identity crisis.
And how did you make peace with that?
The way I made peace with it is I said, well, doctors don't just help people live longer, they also make people feel better. And if someone has HIV and they've lost their face because of medication side effects, or if they're just getting older and aren't liking the way they look in the mirror, you can still help people feel better either way.
Great. Now, what is your take with facial fillers? Because it's very popular. I know you specialize, you have a lot of recognition, you know, in different organizations that I was reading about you being, and also that you do it yourself, but you teach others how to do it right. So what is your take on that? Are we coming to you to say, hey, fix me?
Well, I think that facial fillers, and many people will allow them to get have facial rejuvenation, but without surgery. In many cases, you know, in the old days, you just had surgery. Facelift would give people an artificial look. In many cases, facial fillers can maintain a more youthful look, less downtime, less risk.
Yes. Do you remember a few weeks ago that you made a suggestion? We were talking with John. I also did interviews with John, and you know, he's the one who advising us about how to take care of healthy skin. And you mentioned, and John also, that Josefina, you should take care of these things here. And I went like, no.
I remember that because I said, Josefina, you know, we're doing all this facial rejuvenation. Why don't we get rid of these moles? And you almost recoiled like, oh, and I said, wow, there's something interesting. Let's talk about that.
Yes.
So what was that about?
Well, that was like, when you say that, it's like a no, that's me. How, no, then it was like a no. And then you said, and John also said, you know, you teach this stuff about change and about becoming better, and you should practice what you preach. And I went home and I reflected on that, and I said, you know what? Let me be bold enough to see if I can do this. So here I am, all yours.
Very good. So in addition to facial rejuvenation, we're going to remove some of the moles. And the reason I mention it is that some of the newer techniques for removing moles compared to the old days where you just would remove them with a knife allow us to get them off without causing scarring.
Yes. Okay. So it's anything else. One of the things that I always tell my viewers is like not only come to you and say fix me, but also to take care of themselves. What would you say along those lines? Like when people come to see you, you know, for instance, somebody who smokes, somebody who's a drinker, excessive drinker. So how do you deal with that?
Well, you know, I think medicine, just like you were saying before, is a two-way street. We try to do what we can as a doctor, and give people guidance. That's really part of the job we do. We're like counselors, or we are coaches in a sense.
Exactly.
You do coaching as well.
Absolutely.
To try to share with people what are the best health habits and to spur them on to do those sort of things.
Exactly. So this technology that we're going to be using today is harmless. It doesn't have side effects. People should not be afraid of them. Is that right?
Well, facial fillers, anytime we do procedures, there are potential risks, but I would say the risks are manageable. And that's really true with facial fillers, with mole removal as well.
Okay, well, let's see if you can make me better.
Okay, we'll do it.